Hi, and welcome to this episode of Conversations in Medical Education. Today I'm going to be talking about a really important topic, how to learn to be a compassionate practitioner and how to teach compassion. I'll be talking with Jo Doran, who's a much loved palliative care physician and an expert in the provision of compassionate care and an advocate for compassion. I'll be interested to see what she says. Hi, well, thanks for joining us. The first question I wanted to ask is, why compassion? How did you get interested in compassion?
I think, Matthew, just compassion is just being innate in me. I think I'm just fortunate. When I reflect on my life, I think I was quite a kind child. Not always, but the welfare of other children was something that I thought about. And from a very young age, I always wanted to be a doctor. Mm-hmm. And which sounds really trite, because I have all, I think contribution to society, contribution to community is very important for me. And being a doctor seemed like a very passionate profession. So that's what drew me in. I wanted to be helpful. I wanted to help people. So it was really that simple for me.
So sort of starting as a compassionate person, does that make you think that compassion is innate, or do you think we can teach our students to be more compassionate?
I think it is innate, and you can teach it. Certainly you can teach it. And I think, so I always worry about students who are not compassionate, because I think, because for me, being in medicine, compassion was such a strong component of my drive. I sort of struggled to see how other people would want to be doctors or be in the medical profession or the health professionals without actually having compassion. I was thinking, what is driving them, and is that something that's going to be helpful for patients? And of course it is. I mean, but compassion for me it's just been such a call for me. And I've taken time to understand that you can actually be in the health professions without necessarily being compassionate, but it certainly helps you to be a better doctor if you are compassionate, and it certainly helps you help patients, because patients expect you to be compassionate.
So that sort of addresses some of the motivational issue as to why students not just should be compassionate, but should devote time to cultivating their compassion. Because I guess that's a bit of the thing, is that it's a zero-sum game if you're, not studying if you're studying becoming more compassionate, you're not studying your anatomy in a way, so how that comes out in a zero-sum game requires some motivation to prioritise this as something that's important.
Yeah, I think so. And I think it is important to prioritise it, and it is important to consider it as an essential core component of who you are as a doctor, and certainly as a medical student. And it makes for a much more satisfying interaction with patients and a much more satisfying career if you are motivated by compassion. Although obviously compassion fatigue can be an issue, which I'm sure we'll come to. But I think learning and observing other people who are compassionate can be a bit of an eye-opener for people, that there are different ways of interacting with patients and your colleagues, and coming from a place of compassion in the very broadest sense, because it encompasses things like respect and empathy and all those other qualities. I think it just makes for a happier life. and it certainly makes for a happier career.
Yeah, I think connecting to self-interest is always a good motivational strategy. But talking about compassion fatigue, I don't like that term. What do you think?
Yeah, I don't like it either. And I sometimes have wondered about that in my career. So, you have to. I've felt at times then that I have not necessarily felt the emotion that other people are feeling. And I always remember being a registrar, and I was in Sydney in a training hospital, and the professor of oncology was with another registrar. They'd gone to see a teenager who had a very advanced cancer, was going to die from that. I wasn't involved in this, but the interaction, that obviously had to talk to this person and their family about the fact that they were going to die. And that to me seemed like, wow, that was a massive conversation. And he came back with his registrar to just discuss the notes and things like that. And he was just very chirpy and upbeat. And his registrar said to him, "You're bored, aren't you?" And he said, "Yes." And I thought, this is extraordinary that sort of conversation had just happened, which was life altering for everybody else in the room. And he had conducted it really well in many respects, and answered questions and being open about what was happening, but was able to walk away from that sort of unscathed. And I thought about that and thought whether this is a good thing or a bad thing or just a neutral thing, because you can't take it on, because you can't take on the sadness of that and the potential tragedy of that and continue to function. But at the same time, you don't want to be oblivious to what's just happened. And so I try and just be mindful in my practice of, when I go to a family meeting, the bigness of what's happening, my part in that as an empathic professional. And sometimes I will walk away in tears, and sometimes I will walk away unscathed as well, thinking, have I got compassion fatigue? Or am I just a normal functioning doctor who's at this stage in my career? So I think probably for me, it's just something that I try and be mindful of, and mindful that I'm not losing my sense of what is happening as a palliative care doctor, not losing my sense of patients and families needing to feel that you're invested in their care, and trying to do that trade-off of being focused, being present, being that empathic professional in that situation, but not being completely lost in it. I don't know if that makes sense, Matthew.
No, it does, and I think I'm sort of interested by that. It sort of goes a bit to the concept of non-attachment in a way, and the difference between non-attachment and disengagement in a way. To be able to be there, to be present, but to hold lightly onto that, and not to to hold lightly and separate from that as well. It's an ongoing challenge, and I think that it's a skill, isn't it? Which we would like, to develop as you go along. And I guess the question is, how do you develop those skills? How do you navigate that space in between burnout and the engagement. And the reason I don't like compassion fatigue is that it implies that it's a limited resource that you need to, it leads to a situation where you think you have to hold it and, deal it out sparsely, etc. Whereas I think actually compassion is something that if you give, you get more back. That's the implication that I don't like from the term. But the skill, that skill to be able to navigate that, how do you learn it?
I don't know nothing.
Oh, short interview.
I think I don't know, and I have fallen foul of this. I have been in situations where I felt burnt out and had to take time out. And often it's helplessness that has rendered me burnt out, I think. And that's, sometimes working in a health service, working in palliative care where your service is not seen as a priority. Because you're not saving lives, and sometimes still seen as some sort of luxurious add-on when it's really very integral to healthcare, very integral to healthcare. So dealing with health services has rendered me feeling helpless and left me feeling burnt out when you can't change a situation. And again, it's that non-attachment, which sounds cold sometimes to me as well, but it is holding something lightly and, changing. Oh, my lights have gone off. Sorry. Changing what you can and recognizing, the serenity prayer, recognizing what you can't change and you have to be with.
So I have improved the serenity prayer. You'd be happy to know and added one extra line, which is that you need more than courage to be able to change things. You need skills. And I think that for our students, learning not just what you can change, what you can't, but giving yourself skills in advocacy, giving yourself skills in quality improvement, etc. These are things that I think can help you in those situations where you're faced with a system that's not working and where the challenge to your well-being is the system. Well, then trying to improve it, being effective about improving it, being an advocate for improvement. These are the sorts of approaches that I think we can bring to those situations. They don't always work, but certainly better than whinging, I think. And it's better than despairing as well.
Yes, and it's better than undermining everyone else, which, that's the other thing. Disgruntled workers who are unhappy with the situation can bring the energy of a service down as well. Cynicism is very poisonous and perhaps is the opposite of compassion. I don't know, but that certainly can drain the energy from other people, with people who are constantly cynical or lacking compassion. And I think you're right, having skills in advocacy and skills in change, where change is possible, can be very, very helpful.
And of course, cynicism is one of the symptoms of burnout. So the working in a system where there are a lot of burnout people, there is a lot of cynicism around. I had a patient the other day where really struggled to get some care coordination for them. I rang like 10 people. The first 9 said, "Oh, this is not my job," sort of thing. And the 10th one just said, "Sure, I'll do it. Don't worry about it. I'll help." And the difference between that sort of attitude and the more cynical, protective, etc. response of people that I think were just overwhelmed and burnt out is a big difference for the impact it makes on all of us.
It is, and it's something we try and instill into the registrars. When you answer the phone, you say, "Hello, it's blah blah blah. How can I help you?" And we want to be the friendly, helpful team. That's what I say. You want to be friendly and helpful, and if you can do those two things, we're halfway there. And I remember a registrar who was post ICU and post COVID and just dejected. Not burnt out, but dejected, exhausted, and obviously feeling very, very pulled upon during that time, and would answer the phone with, "Yeah," and it's awful that we would work in a system that would do that to someone who's young and motivated and bright. But by the end of his time of palliative care was, "Yes, it's blah, 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 how can I help you?" Which was lovely to see that turnaround. Lovely to see that.
The palliative care is selected for having beautiful people in it, that support each other, and I think that having that compassionate approach to the patients, should really be connected to our compassion for each other, and being in that environment where people do care for you and look out for you, notice that you're dejected, etc., I think is one of the things that helps us build our compassion. And I guess you've highlighted one of the things, for the students about how to learn to be compassionate is just to notice that. Notice the difference in between, a team that supports their people and a team that doesn't, and what impact that has, and use that as motivation, I think, for you to be compassionate to your colleagues, to make an effort to be that person that's lifting them up rather than lifting them down, and notice the difference between the different way people talk, the different role models that you have presented, because some of them are not good, and some of them are really good. So I think that, to me, that's probably one of the things that's helped me to learn to be more compassionate, is role models of people that say, "Yeah, I want to be, this works, this is good, this is who I want to be, I'm going to be like that." And it starts with noticing, I think.
So you start, yeah, exactly. And so I'm always suspicious of doctors who are nice to patients and horrible to their colleagues.
Yep.
If you innately kind, you should be kind to everyone, and not, that might be seen as weak potentially, or foppish somehow, but it's not. It's just about being respectful and treating other people as you want to be treated. And, like a friend of mine was at a meeting last week and got shouted at in front of other people, which you just don't do, unless the building's on fire and you're telling someone to get out. It just, there's no room for that, and that's not a compassionate or kind place to work, and it's very demoralizing. But I heard someone say recently, if you admonish in private and praise in public, and that's a compassionate way to do something.
Yep. So as you're talking about about this, it seems to me that it's your reflective practice that has helped in these situations that you've been talking about reflecting on what's happened and noticing, not just noticing the episodes of compassion or compassion failure, but reflecting on it. Is that come natural to you, or have you developed a practice of, reflecting about your performance and the performance of others in being compassionate?
It's probably a practice that I've developed. So I've always been very self-critical my whole life. So I will, play or have done sort of play over my working day, and as I'm driving home, just thinking, did I do that? Was that the right thing to say? What would I do differently? Which is, and I still do that now, but in a less harsh voice to myself, because we're all still learning, and even now I'm thinking, okay, well, next time I'll do this differently. So it is a reflective practice, and there's an element of perfectionism in doctors, I think, where we, try to do our best all the time, and that reflective practice is helpful for that, certainly. Self-criticism is a different thing. But yes, I have cultivated mindfulness in my practice. I see sometimes, and this is going to sound strange, but like a very difficult conversation that's coming up, or someone who challenges me, usually, patients sometimes, but often family members. I do enter into that consultation as like a meditation, where I try and be very still, very focused, and very present to what is happening, and not be tangled up in any sort of emotions that are arising in me. So it is like a meditation for me, in that be in a very still place when there's potentially turmoil around. I don't know if that makes sense, Matthew, but it's
it makes sense entirely. I think part of the skill is to be able to disconnect from all the other things that are happening, the beepers and the noise and the conversation in the bed next to you in a 4-bedded room, being able to disconnect from all of that and be present. But I think it is a form of mindfulness, and I find I sort of go into a zone, like you. It is a sort of flow state, I think. When you're completely focused on the person in front of you and nothing else matters, you're just there. Practicing that. I think a practice of mindfulness helps you with that. And I think that experience probably helps you with a practice of mindfulness as well. That makes complete sense, I think. What about a difficult patient, where you're not feeling very compassionate because they're, difficult patient? Do you have a strategy where you sort of can marshal your compassion? Do you is there a cognitive sort of process you go through when you're feeling your compassion is challenged?
Yes, there is. There are certain aspects and certain behaviours which I find challenging. And I have had a patient recently who has challenged me in a variety of ways, and in my best self, I can really take this as practice of doing my best to be compassionate for someone who's really irritating me, let's be honest.
Yep.
So, and I take great pleasure almost. Not pleasure is the wrong word, but I have a sense of peacefulness if I'm able to behave in a way that they would have no idea that I'm not feeling the love, and in going through that practice, I end up feeling I end up feeling compassion for the person, because they're not setting out to be challenging and difficult. And there's this lovely phrase I was taught, what is it about this kind and loving family member that is making them so challenging? And ultimately, Matthew, we are all just trying to get by. I feel like we're all just trying to do our best. We're trying to get by, and at the at the very, very core of human existence. And this person is just doing the same as me. They're trying to get by, and they might have all sorts of things I haven't tapped into that's making them behave in a way that challenges me. And there's another good phrase: whose needs am I trying to meet? Is it my needs? Is it their needs? And I'm there to meet their needs. As a health professional, my needs are kind of secondary, and I can meet my needs outside that consultation space.
Yep. The words of wisdom, I think. Well, thank you. You've really, provided, I think, a great introduction on why compassion is important, what it does for us as well as for our patients, and some strategies about the how to learn to be more compassionate through a mindful practice, through reflection on your practice, and through strategies to boost your compassion when you feel it's fading, or a person that you're not feeling well connected to. So I'm really grateful for those insights. For a student that or for anyone that wants to deepen their reserves of compassion, deepen their understanding of what it takes to grow their compassion and cultivate it, is there anywhere that you'd recommend them to go or do or read or listen to help with that?
Look, I think the Buddhists have got this one, Matthew. Thich Nhat Hanh, which is, I mean, that's what the Dalai Lama says, isn't it? My religion is kindness. I think seek out other individuals that you connect with, and find out what they're doing. There's a lot, I think there's someone was telling me about a book yesterday, Compassionomics or something like that. I can't remember. Anyway, it sounds like a good book to read. Mm-hmm. I think being it, is being compassionate is as good a practice as any. I think learning from other people. I think, we've talked about mindfulness and things like that. I think being self-aware, and having, it doesn't have to be hard. This compassion takes all sorts of forms. Like we have bake-offs here, where we all compete for bake-offs. We do Zumba once a week. It's about just having genuine care for your fellow human being, and being kind to yourself if you're occasionally a rat bag, I suppose. That's the other thing. We can't all walk around being our best selves 100% of the time.
So being kind to yourself is, I think, part of that. And the only thing I think you left out is getting a dog.
I say that to everyone. If you really want to watch a spiritual being, look at a dog. They're in the moment. No one greets you like a dog. I say this all the time. That person doesn't need pain medication. They need a dog. Absolutely. Cats, not so much.
Oh, thank you very much for your time. Really appreciate that, and I think there's some things for all of us to think about there. Thanks again.
Yeah, thank you so much for asking me, Matthew. This is a great project that you're doing, so I really appreciate it. Thank you.